Hi, Miss Mullen. My name's Caitlin. I'm a student nurse at St. Francis. I'm going to be doing an assessment on you today. So first, I'll just have you tell me your name and date of birth. I'm going to go ahead and check your wristband. All right, perfect. So first I'm going to go ahead and take some vitals. So I would go ahead and take blood pressure. I would get her temperature, respirations, make sure that I'm getting their pulse. I'm going to go ahead and listen to her heart sounds in all 5 quadrants, and then I'm going to listen to breath sounds bilaterally. All right, and then I would ask Miss Mullen if she was in any pain today, and then I would ask her to rate it on a scale of 1 to 10 and just see how her pain has progressed clinically. So after doing vital signs, I'm going to go ahead and look at breasts. So I'm going to palpate in a circular motion on each breast. I'm just feeling for any bumps, see if it's soft or hard. I'm seeing if there's any warmth. I'm seeing if there's any nipple cracking, any leakage, any pain, anything like that, and asking her subjective questions about it. Then I'm going to go ahead and ask her any subjective questioning about her stomach. So I'm going to go ahead and feel for her fundus. I'm going to use 2 hands at the bottom and the top of the uterus. So I'm feeling for the top of the fundus. Right now it's level with the umbilicus. That's normal since she just had her birth today. It's firm, it's in the midline. Something that I can educate my patient on is if the top of the fundus was off to the side or if it was above the umbilicus. Is that if even if she doesn't feel the need to void, try to void every 2 hours, just because she might not feel the urge to. And also when I do this, I'm going to go ahead and make sure that I'm lowering the head of the bed so I can feel it, because sometimes it can elevate it when you have it raised. So I'm going to go ahead and feel it again, just making sure, yep, it's still at the umbilicus. So I'd go ahead and educate my patient on that. Then at this point, I can ask my patient about their bowel and bladder patterns. So I can ask when her last bowel movement was, if she's passing any gas. If she does say that she's constipated, I can ask her what she's been doing for that. I can tell her that she should increase her fibers, increase walking around, that would help, and increase any fluids. Then I'm going to go ahead and ask her about her urine, when her last void was, if there's any pain with that, and any signs of a UTI, like increased white blood cells, any pain with that. And then I could educate her if she does feel that pain. The spray bottle, provided that she can clean her perineal area with, she can go ahead and spray that while she's urinating. Then I'm going to go ahead and listen to the bowel sounds. So I'm going to go ahead and listen to all 4 quadrants. And I would want to make sure that I would do this before palpating the abdomen. So typically before you would palpate the fundus. All right, and then I would palpate and feel for any tenderness in her abdomen. All right, and then I would go ahead and roll my patient onto their side. So I would take this opportunity, if they had an epidural, to look at the epidural dressing, make sure that it's intact, any redness with that. I can look for hemorrhoids, ask about any pain, look at clinical progression for that. I can also look at the episiotomy, and if they had one, and test it for any redness, edema, ecchymosis, make sure that it's approximated and that there's any drainage there. Then I can go ahead and I would pull down her underwear, and I would ask her about when she last changed her pad. I could educate my patient on changing it every time that they void, just so that they're decreasing any risk for infection. I would look at the lochia. So for this patient, it was bright red, which is normal since she just had birth that day. There's no foul odor. I would assess the amount of it, and so if my patient tells me that she hasn't changed it in 2 hours, I would divide the amount by 2. And I can also educate my patient here that if the color does go to a lighter pink and it seems like it's kind of thinning out and everything, and then it goes back to that bright red, that she should alert her healthcare provider because it could be a sign of a hemorrhage. Also educate her here that small clots are okay, but if there's bigger clots, that could indicate that there's another complication and that she needs to make sure and alert her healthcare provider about that as well. And like I said, there's no foul smell, anything like that. I can also just ask her any other subjective questioning, anything else that would relate to a UTI, like the urgency, the pain, the frequency, anything like that. While I'm up here, I'm gonna go ahead and look at her IV sites, make sure that everything is intact, there's no redness. Ask patient about any pain with her IV. Then I'm also going to empty her catheter if she had a catheter. When I was asking subjective questioning about her bladder, I could also just make sure that there's no signs of a catheter-associated UTI, making sure that I'm doing good perineal care. Then I'm gonna go ahead and look at her legs. I'm checking for any DVTs. So there is some slight swelling, but it's symmetrical, so that's okay. Asking for any pain. I'm feeling for any warm spots and any redness. So she's good there. And then throughout the entire assessment, I'm just assessing my mom's mood, seeing that there's any changes. Right now, my patient seems to be happy, eager to learn anything. So that's good. I'm gonna go ahead and raise my mom back up. Then I'm just gonna ask my mom if she has any questions that I can answer or anything else that I can do for her.